Hello everyone, I am Dr Lokesh Handa, consultant plastic surgeon practicing in South Delhi, Greater Kailash. Today we will be discussing a patient of hair transplant, and this gentleman, he is a 32-year-old male and he was suffering from hair loss for the last 10 years or so with no family history of baldness, and he didn't have any medical or surgical history, and he was not taking any supplements or any history of medications or multivitamins, and not even the medications for the hair loss. So he presented to us with grade 6 or grade 7 baldness, and since his donor area was small, so we planned the hair transplant in 2 sessions. So in the first session, which we are doing today, so we have planned around 3500 grafts, which will be in the frontotemporal area and the mid scalp of the patient. So here you can see the pre-operative pictures of the patients in the front profile, in the side profile, and also the donor area of the patient. After the markings are done, then the shaving of the patient is done and patient is taken into the operation theatre. Here you can see that we are giving local anesthesia injection in the frontal area. So we will be making slits first. So in these slits, we will be putting the grafts which we will be taking from the donor area. So these slits that we are making, they are made at a particular angle based on the site where these are being made. And these slits in the frontal area, they are placed with a very high density so that we can give a very natural appearance to the patient once his hairs grow after the result. These slits are placed in a very regular manner and in a kind of meshwork pattern, and when we are approaching the slits in the hairline area, then we keep the hairline very irregular again to give a very natural appearance to the hairline. The slits in the back areas where there are hairs, so we have to make these slits in between the hairs so that we don't damage the existing hairs. In the temporal or the side areas, the angles are kept very acute so that the hairs, when they grow vertically downwards. So now here you can see the final picture of the slits that we have made, and once the slits are ready, then we inject local anesthesia in the donor areas, and then we start harvesting the grafts from the donor area. We harvest the grafts from the donor area using a motorized punch. So these punches, they are usually less than 1 millimeter in size. 0.7 mm, 0.8 mm are the most frequently used punches, and these punches, they are punched at a specific angle. We always keep a little bit of hair above the skin so that we know the direction from where the hair is coming out, and in that direction only we punch, and that ensures that we do not damage the root of the hair. When we make the slits, we always count the number of the slits. That ensures that we do not harvest any extra grafts or lot of grafts. So since we have made around 3500 slits, so the target number of the grafts is 3500, and here we are separating the grafts. The grafts, they are either 1 hair, 2 hair, 3 hair or 4 hairs. So these grafts are separated according to the number of the hairs in them. And now we are seeing the placement of the grafts. The graft placement is usually done in a way that in the hairline, in the frontal area, we put single hair grafts to give a very natural appearance, and behind the hairline, behind 2 to 3 rows, then we start putting 2 and 3 hair grafts. Here you can see the complete result after the hair transplant. So these are the front and the side profiles of the patient, and also the donor area of the patient. And once the dressing is done, then we put a headband across the forehead so that no swelling comes onto the face.